Hello, I'm Dr. Jason Saunders with HBOT USA. Another frequently asked question: is hyperbaric oxygen safe for my child or infant? So there are a multitude of potential conditions that people seek hyperbaric therapy for children and infants, typically related to either neurologic damage or trauma, whether TBI, concussion, or even things like CP and autism. Sometimes strokes early on, or maybe force used during labor and delivery. And so it turns out that hyperbaric oxygen, especially for neurologic conditions, and especially for any neurologic condition that may have been caused by some degree of ischemia or lack of blood flow, this type of therapy seems to be very effective, especially on children, because their brains are still growing and developing so rapidly that, neuroplasticity is a term used to describe how our brains can basically heal and learn new pathways. So to basically be able to send and communicate the same types of messages, but maybe take a different highway or a different pathway than what it was originally designed to do. But that allows us to regain function lost through some type of damage or trauma. And the fuel source, one of the main fuel sources required for improving the amount and type of neuroplasticity that we can expect is oxygen. And one of the only ways we have to increase the level of oxygen absorption in our body is hyperbaric therapy. And so, it's an amazing tool for so many of these cases and so many of these conditions to improve the level of oxygen that these children are able to absorb, to basically wake up and light up these different pathways, to improve nerve healing, to improve brain healing, to regrow blood vessels, to release stem cells in our brain to promote that healing response. This is an amazing therapy for so many of these kids, which changes the lives of many families that we have a chance to work with, either virtually through getting them access to chambers at home or treating them in one of our clinics. So the question becomes, is it safe? And the answer, of course, is yes. Different types of therapies, different types of chambers, different levels of pressure, and different levels of oxygen are all required for different cases. So depending on the extent of the damage, depending on how long ago it may have been, depending on what the goals are for the outcomes for the treatment, would all determine if a home therapy would be appropriate or if it should be done in a clinical environment. But ultimately, the main contraindication to hyperbaric therapy is pneumothorax or a popped rib, a popped lung, usually through a fractured rib or something like this. If we don't have a pneumothorax, the main other contraindications are congestion, or basically the ability for us to clear our ears. And so the concern becomes, well, for you and I, maybe we could just sort of pinch our nose and blow our ears out or yawn. We could feel the pressure and we know what to do to handle that. And that might be difficult to either explain or have children be able to do. However, especially for, let's say, a nursing infant or a child, for much younger ages, either nursing the child, typically with younger children, we have the parent go in the chamber with the child, so they're not in there alone in the first place. And if we have a mechanism for getting them to pop their ears, whether they understand that that's what they're doing or not, but we have a mechanism to allow that to happen, to allow their ears to clear while they're pressurizing, it's a perfectly safe modality. And so we'll typically have that child either nursing, drinking from a bottle, potentially on a pacifier, for those younger ages, or just having like a sippy cup and a water bottle inside the chamber. The act of swallowing is often enough, especially in kids. Their eardrums are much more flexible than ours. And so children tend to tolerate these pressures much better than their parents. Children typically enjoy the sessions much more than their parents. And their ability to clear their ears with a simple mechanism like nursing, a pacifier, drinking water, or if they're a little older, maybe chewing a little bit of gum or having a water bottle inside the chamber, and allowing that ear to clear will alleviate any pressure issues for that child during the treatment. And just like being in an airplane, you feel the pressure changes while you're changing elevation. But once you're at elevation, you wouldn't even know that the cabin was pressurized, right? You don't even feel it until you're coming back down again. And so a chamber is very similar to that. As it's pressurizing, you'll feel the pressure in your ears, and so will your children. As long as we're able to clear that and get them comfortable, the whole, that's only the first 5 minutes or so. The whole rest of the session, while you're at pressure, it doesn't feel like pressure, so you'd have no idea that you're even under pressure or in a pressurized environment, so it's very comfortable. And then lastly, for the last 5 or 8 minutes, while you're depressurizing, we would have that experience again. And so as long as we have some type of tool and remedy so that child can clear their ears, and there's no other condition that we need to know about that might make hyperbaric either unsafe or otherwise uncomfortable, it's actually a very safe, very simple, and very effective therapy for so many of these especially pediatric neurologic conditions. So I hope that helps to answer the question. Yes, absolutely. Hyperbaric therapy is safe for your infant. It is safe for your child. And it is a powerful tool for so many of those conditions. Until next time, see you.